We are joined now by Dr. Alex Jahangir. He is the chair of the Metro Coronavirus Task Force.
Well, first of all, Dr. Jahangir, it was nice to be able to report some more measured numbers today. How are we doing in this modified phase 2 of reopening? And tell us, what is holding us here before we can get to phase 3?
Well, I'll tell you, we are doing remarkably well. We now have lowered our average case to about 244 cases a day, which goes and in the rolling average of about 27 cases per 100,000 people. And to put that in reference, anything 25 and above is considered severe. We hit 65 per 100,000 just 2 weeks ago. Below 10, we can go visit our family members in nursing homes. So we're making great progress. When can we roll back to another phase or maybe to phase 3? I will tell you this. We are kind of using some of my day job, the trauma surgeon thing. We've had a patient that now we've stopped the bleeding. And now we're trying to stabilize that patient and let that patient get his or her energy back and get that person back to rehab. So we still got a little bit to go. I'm grateful for everyone what everyone has done, but we're not there yet. But we have made some great progress, and we're going to continue to.
Okay. And we've been talking about a lot, hydroxychloroquine. Medical experts, they seem to be torn over the use of it right now as a treatment for COVID-19 symptoms. So what's your professional opinion of whether it's a viable treatment or not?
Listen, I don't know why this question still keeps coming up, because every serious study out there has shown that hydroxychloroquine is not effective for this disease, period. Furthermore, the Assistant Secretary of Health, the current sitting Assistant Secretary of Health who oversees this stuff, has said the same thing. The director of the FDA has said this thing. The director of the CDC has said this. I think people who are saying this are really playing to a base, and I think the science has shown that it's not beneficial, and in fact, it can be harmful if this drug is taken for an indication for which it is not indicated.
Okay, so let's not say hydroxychloroquine again. What is an effective drug? What do people need to know about it? Because I will say, talking to friends around who have parents in COVID units, they're staying shorter amounts of time, so clearly some progress in how patients are being treated.
Absolutely. I think remdesivir is a drug that's been shown to have a lot of effect for people who are really sick in the hospital. There's been some studies and some benefits shown with dexamethasone, which is a type of steroid. And then beyond that, the hospitals have really learned how better to use ventilators and other oxygen treatment in the hospital. So if you do get sick enough to get in the hospital, you're absolutely right. People are doing better. Because of the hard work that these people who really are taking care of them on the front lines are doing. So there are a lot of advances. Hydroxychloroquine is not one of them.
All right. We always learn a lot when we talk to you. Thank you so much, Dr. Alex Jahangir, for joining us.